We've talked a lot about hormones and how they help us to start having periods, how we can have more regular periods. And that period of years between what we call menarche, when we start having periods, and menopause, when we stop having periods, can be several decades. And there's no reason that you have to suffer. Your periods can be nice and normal, and believe it or not even painful. You can even get rid of PMS. So let's talk a little bit about that PMS thing. So estrogen helps us to make serotonin and dopamine. It helps us to have really strong muscles. It helps us to use our insulin better so that we don't have high blood sugars or the big drops in our blood sugars. And if we get too much estrogen, we start having breast pain, we have water retention, irritability, and headaches. And at the end of our cycle, right before we start having a period every month, our estrogen drops down. So if your estrogen has been really high, the drop is going to be greater, so you're going to be feeling the symptoms even more. So when we have that drop in estrogen, if we have enough progesterone, then the progesterone, it comes in and soothes us. It shelters us from that drop in estrogen. And if you don't make enough progesterone, if your progesterone receptors are not very sensitive, meaning that the progesterone can't plug into those receptors well, and then if you have too great of a progesterone drop, like it doesn't hang around long enough, then you are more prone to having PMS symptoms. So we're going to talk more about that.